Ever tripped over absolutely nothing and just thought, well, there goes my ankle?
Or done something in a sports game and had that sinking feel.
Exactly. And that's what we're diving deep into today, musculoskeletal trauma. But this isn't some dry textbook lecture. Oh no, we're going for the need-to-know, the cheat sheet version.
We've got excerpts from this dense musculoskeletal trauma source.
And whether you're prepping for an exam or, like me, just morbidly curious about what happens when things go crack.
It's fascinating how often those everyday mishaps become complex medical situations.
Exactly.
Yeah.
So let's decode it all a bit. Now, the source jumps right into this ABCDE approach. Is it as simple as it sounds?
Deceptively so. It's the backbone of trauma care, that mental checklist. Imagine you're first on the scene. Airway. Can they breathe? Breathing. Are they struggling?
Yeah.
Circulation. Any major bleeding. Disability. Spinal injury. Unconsciousness, And finally, exposure. Getting a clear picture of the injuries.
So it's like triage for the body. Makes sense.
Exactly. You're tackling the most critical things first.
But then we move from that initial crisis to, okay, what's the damage? Broken bones, dislocations, all that fun stuff. And that's where I think those medical terms can get a bit intimidating.
Right, like open versus closed fractures.
Sounds simple enough.
Well, picture this, a simple crack where the skin's intact. Closed. But you've got bone poking out.
Yikes. Okay, that's an image that'll stick with me.
That's an open fracture, and it's a whole different ballgame.
So way more serious.
Absolutely, an orthopedic emergency, in fact. That open wound. It's an invitation for infection to get into the bone itself.
Hence the urgency. So what needs to happen right away in that situation?
The source really emphasizes this three-pronged approach. Sterile dressing on the wound, antibiotics to combat potential infection, and then you're looking at surgery, surgical debridement.
Okay, so cleaning out the wound, removing any damaged tissue to prevent things from getting worse.
Exactly. You want to control the situation as much as possible.
It makes you realize how crucial those initial actions can be. And speaking of things escalating quickly, the source also mentions something called compartment syndrome.
Now, that one does sound a bit like something from a medical thriller.
Right, so what is it?
Okay, so imagine your muscles are encased in this tight, inflexible sleeve, right? When pressure builds up within that compartment, it restricts blood flow to the area.
And that's bad because...
Because it's like suffocating your muscles and nerves, which can lead to permanent damage if it's not addressed quickly.
So what should we be looking out for? How do you even know if it's compartment syndrome?
That's the tricky part. It might not always be obvious at first, but the source highlights some key things. Pain that seems way worse than it should, especially pain that intensifies when you stretch. You might also notice swelling, tightness, pale skin, a weak pulse in the area.
And in severe cases.
Numbness, even paralysis.
Okay, definitely not something to ignore. What happens if you suspect compartment syndrome? Straight to the hospital.
You got it. Early diagnosis and treatment are key. Doctors can actually measure the pressure within the muscle compartment using a special needle.
Now, that sounds a bit intense.
It's quick, and the information it gives is crucial. The source mentions a pressure greater than 30 millimeters of mercury. That's when alarm bells really start ringing.
And if it is that high?
Then it's time for a fasciotomy.
Say that again?
A fasciotomy. It's a surgical procedure where they make an incision to relieve that pressure.
So cutting open that inflexible sleeve you mentioned to give those muscles and nerves some breathing room.
Exactly. Restore normal blood flow, prevent lasting damage.
Wow. Well, it's incredible how those quick interventions can make such a difference. So we've covered the initial ABCDE assessment, tackled the scary stuff like open fractures and compartment syndrome. What's next on our musculoskeletal trauma tour?
Now that we've laid the groundwork, it's time for an anatomical adventure. The source goes into detail about specific injuries, starting with pelvic fractures.
Ah, yes, those are the ones that can be life-threatening because of the bleeding, right? I've heard they use those specialized pelvic binders.
It's like a real-life superpower. Applying that binder can help control internal bleeding, which is absolutely crucial in those first critical moments.
Okay, that's definitely good to know. So we're about to embark on this whirlwind tour of the body, highlighting key points about different types of fractures and dislocations, from pelvis to pinky toe, or maybe the other way around. Where should we even begin?
Let's start with a bone that's surprisingly easy to break, the clavicle.
The clavicle. You mean the collarbone. I wouldn't have thought that was a common fracture.
You'd be surprised. They're incredibly frequent, especially after a fall or a direct blow.
You learn something new every day. So what's the typical treatment? Surgery.
Not always. The good news is that most midshaft clavicle fractures, the ones in the middle of the bone, can actually heal well with just a simple sling.
So no need for pins and plates. That's a relief.
Exactly. However, if the fracture is significantly displaced, meaning the broken ends aren't lining up properly, or if the bone is shortened, surgery might be necessary to make sure everything heals properly and the shoulder functions the way it should.
Makes sense. So moving down the arm, what about humerus fractures?
Those are interesting because they often come with a risk of radial nerve injury.
The radial nerve. See, now that sounds a lot more serious than a simple broken bone.
It can be. The radial nerve controls the muscles that extend your wrist and fingers, and it gives you sensation on the back of your hand. So if it's injured, you might experience wrist drop, the inability to lift your wrist, and decreased sensation in that area.
So it's not just about the broken bone itself, but also what that break might be doing to the surrounding nerves and what that means for everyday function.
Exactly. And it highlights why that thorough neurological exam is so important after any fracture. Now let's talk about a bone that's notorious for causing headaches and trauma, the scaphoid.
The scaphoid, isn't that a type of ship?
It is, and as it turns out, there's a tiny bone in your wrist, shaped just like a little canoe, also called a scaphoid.
No way. I had no idea. So what's the big deal with this little boat-shaped bone?
It's deceptively fragile, and because of its size and location, fractures are often missed on those initial x-rays.
Wait, seriously, you could have a fracture and not even know it.
It's possible, especially if the fracture is small or doesn't show up clearly. The VORS recommends playing it safe if they suspect a scaphoid fracture. They'll immobilize the wrist and might even do repeat x-rays later on to be sure.
Better safe than sorry, right? Especially with something as important as your hand. So from the subtle scaphoid, let's talk about a bone that's anything but subtle when it breaks: the hip.
Ah, yes, hip fracture is a major concern, especially as we get older.
It's one of those injuries you always hear about happening, especially in elderly individuals.
And for good reason. It's sadly quite common as we age, especially with conditions like osteoporosis weakening the bones. Even minor falls can become risky.
So what's the usual course of action with a hip fracture? Is it always surgery?
In most cases, yes. Surgery is needed to stabilize the fracture and allow for early mobilization. This can range from fixing the fracture with pins, plates, or screws to a full-on hip replacement, depending on the severity.
It's incredible what they can do these days. Okay, we've covered clavicle, humerus, that tricky little scaphoid. Now onto the hip. Are we ready to tackle the femur? I have a feeling that's a whole other ballgame.
The femur, or thigh bone, is the largest bone in the body, and femoral shaft fractures are definitely a big deal.
Just the name femoral shaft fracture sounds intense. What makes them so serious?
Well, for starters, they're often associated with significant blood loss.
Wow, okay. That definitely elevates the stakes. So what's the first line of defense in a situation like that?
Stabilization is key, and they'll often use a traction splint to do that.
Wait, a traction splint? Like what they show in those old medical dramas with ropes and pulleys?
It might sound a bit medieval, but it's incredibly effective. It helps stabilize the fracture, reduce pain, and minimize bleeding until they can get you into surgery.
So it's all about buying time to then address the underlying issue. It sounds like a well-choreographed dance between those initial life-saving measures and the surgical expertise. Speaking of which, what about knee dislocations? Those just sound excruciating.
They're certainly high up there on the pain scale, and they're considered true orthopedic emergencies. You see, there's this crucial artery that runs behind the knee, the popliteal artery.
And if that gets damaged?
It's not good. A damaged popliteal artery can compromise blood flow to the lower leg, and that's why knee dislocations need immediate attention.
So it's another race against time. Every second counts. What's the procedure for a knee dislocation?
The first step is to get that knee back into its proper position reduction, and the source really emphasizes the need to assess those blood vessels quickly, often using imaging.
It's amazing how interconnected everything is. You wouldn't think a dislocated knee would potentially involve blood vessel damage, but it makes sense when you think about it. Speaking of interconnected, let's talk about the tibia. As someone who's experienced my fair share of shin splints, I'm guessing tibial fractures are no walk in the park.
You're right about that. The tibia, or shin bone, definitely takes a lot of abuse. And tibial fractures, let's just say they often come with a side of soft tissue injuries.
Because the tibia is right there at the front, not a lot of padding.
Exactly. And we need to remember our earlier chat about compartment syndrome. Well, tibial fractures, especially those involving the top part of the shin bone that forms the knee joint, those have a higher risk of developing this condition.
So it's like this domino effect, one injury potentially leading to another. This is where it gets really complicated.
It does highlight why a comprehensive approach to diagnosis and treatment is so crucial.
You've got to look at the whole picture, not just the most obvious injury. Speaking of looking at the whole picture, what about foot fractures? Our poor feet, they take a beating every single day.
They do, and the source highlights one fracture that's notoriously painful, the calcaneus fracture,
The calcaneus, remind me again where that one is.
the heel bone.
Right, and now that you mention it, I can see why that would be incredibly painful. What usually causes a calcaneus fracture?
They often happen from falls. Stepping off a curb awkwardly or, in more severe cases, falling from a height. That impact sends a lot of force through the heel.
Ouch. Just thinking about it makes me want to walk on my tiptoes. So how do you even begin to treat a calcaneus fracture?
Well, they often need a CT scan because those fracture patterns can be pretty complex. Treatment depends on the severity and can range from immobilization in a boot or cast to surgery, particularly if the fracture involves the joint.
So it's not just a matter of slapping on a cast and calling it a day. It sounds like foot fractures, even if they don't seem as dramatic as a broken leg, can be quite complicated.
They can indeed. Now, before we wrap up our whirlwind anatomical tour, there's one more area we need to cover: the ankle.
Yes, the ankle. Another joint that's probably seen its fair share of mishaps. And I'm guessing there are a lot of different types of ankle fractures.
You're right. The source actually breaks ankle fractures down based on which malleoli are involved.
Malleoli. More new vocabulary. Refresh my memory here. What are malleoli?
Think about those bony bumps you can feel on either side of your ankle.
Right.
Those are your malleoli. You have one on the inside and one on the outside.
Okay, so those bony landmarks. Ankle fractures are categorized by whether you break one or both of those bumps.
Exactly. You can have a unmalleolar fracture where only one malleolus is broken, a bimalleolar fracture involving both, or even a trimalleolar fracture, which includes that bony prominence on the back of your tibia.
Wow, who knew there were so many ways to break your ankle? So how do they decide between surgery or something more conservative, like a cast?
It all comes down to stability. If the ankle joint is stable, meaning the ligaments are intact and the bones are lined up properly, a cast or a boot might be enough. But if it's unstable, surgery is often needed to realign the bones and stabilize the joint with plates and screws.
So it's not just about whether the bone is broken, but how that break impacts the stability of the entire joint.
Precisely. And managing musculoskeletal trauma often requires a whole team: orthopedic surgeons, plastic surgeons if there's significant skin damage, vascular surgeons if there are blood vessel injuries, and of course those rehabilitation therapists to get you back on your feet, literally.
It's a team effort. We've covered so much ground today, but it occurs to me we've mainly focused on that immediate aftermath of these injuries. What about the long-term implications? What are some of the challenges people might face down the road?
That's an excellent point and a perfect segue into the broader context of musculoskeletal trauma, because the source doesn't just stop at that initial treatment. It gets into potential complications, long-term management, and the overall impact these events can have on a patient's life.
Okay, so let's dive into that bigger picture when we come back. We've definitely given our listeners a lot to think about already. All right, so we're back and ready to tackle those long-term challenges you mentioned. I have to admit, after that anatomical adventure, I'm already feeling a bit sore by proxy.
It's easy to focus on that immediate fix-it phase, but musculoskeletal injuries, they can have a lasting impact. And one concern the source highlights is this thing called post-traumatic arthritis.
Okay, so arthritis after a fracture. Does that happen with any type of break?
It's most common after those breaks that actually extend into the joint space, what we call intra-articular fractures. Imagine the smooth surface of a joint, like a well-oiled hinge. A fracture that disrupts that surface can really increase the risk of developing arthritis down the road.
So it's like those breaks never quite heal the same way, even if you do everything right.
That's a good way to put it. The source really emphasizes the importance of early recognition and management of this type of arthritis to slow its progression and maintain as much joint function as possible.
So it's another reason why that initial assessment is so crucial. What about other potential complications? I know infections can be a big concern with those open fractures we talked about.
Absolutely, and the source dedicates a whole section to a particularly nasty one: osteomyelitis.
Osteomyelitis. Okay, that sounds serious.
It is. It's an infection of the bone itself, and it can be really tough to treat, especially with those open fractures or if there are any foreign objects, involved.
That makes sense. How do they even begin to treat something like that?
Well, as we talked about earlier with open fractures, that Immediate, thorough cleaning of the wound, the surgical debridement is absolutely essential. It's all about removing any contaminants that could lead to infection.
Get rid of anything that doesn't belong.
Exactly. And of course, antibiotics are crucial in treating and preventing these types of bone infections. They're like the heavy hitters in this scenario.
Okay, so we've got post-traumatic arthritis, we've got bone infections. Anything else we should have on our radar?
Well, there's also the issue of tetanus.
Tetanus, isn't that what you get from stepping on a rusty nail? Not exactly what I'd picture as, high-impact trauma.
It's true that rusty nails are often involved, but tetanus bacteria can actually enter through any open wound, including those from, you guessed it, fractures.
So even if it's not a rusty nail situation, you still need to be thinking about tetanus with any fracture.
Especially if someone hasn't had their tetanus shot in a while.
Yeah.
It's always better to be safe than sorry. And on that note of being proactive, there are some systemic complications we need to touch on as well.
Systemic complications, meaning they affect the whole body. Okay, this just got real.
They can be quite serious. One example the source mentions is fat embolism syndrome.
Fat embolism syndrome. That almost sounds like a medical mystery. What is that exactly?
So it's actually a potential complication after certain types of fractures, particularly those long bone fractures like a femur fracture.
The big one, yeah. But what's actually happening in the body?
Essentially, fat droplets from the bone marrow can escape into the bloodstream and travel to other parts of the body, the lungs, the brain, even the skin.
So it's like the body's own response to the injury is causing further damage. That's wild.
It is a bit of a paradox.
Yeah.
And those fat droplets can wreak havoc, causing breathing problems, confusion, even this characteristic rash.
Oh. Okay, what about this crush syndrome the source mentions? I have a feeling this is another one I don't want to experience firsthand.
Yeah, crush syndrome is definitely serious. It can happen when there's this prolonged compression of muscle tissue, like in a crushing injury.
I can imagine that would be a concern in a major accident. So what are the implications there?
The compressed muscles actually start to break down, and they release substances into the bloodstream that can damage the kidneys. You're talking about a whole cascade of potential issues, electrolyte imbalances, even cardiac arrest.
It's amazing how the body can be so resilient in some ways and yet so fragile in others.
Exactly. And that brings us back to the importance of that neurovascular assessment after any fracture or dislocation. We touched on it earlier with the radial nerve injury, but it's a crucial step in any musculoskeletal trauma evaluation.
So checking for pulses, capillary refill, that's the thing where you press on the skin and see how quickly the color returns, right?
Exactly.
And making sure there's normal sensation in the limb.
You got it. It helps determine if there's any damage to those blood vessels or nerves.
Huh.
And if there is, addressing it quickly can prevent long-term problems down the line.
It's another reason why those early interventions can be so crucial. But beyond the, physical complications, we also need to consider the emotional and practical challenges of recovering from these injuries.
100%. Musculoskeletal injuries can have a huge impact on a patient's quality of life. Chronic pain, limited mobility, difficulty doing those everyday tasks we take for granted, these things, can really take a toll mentally and emotionally, not to mention the social isolation that can come with a prolonged recovery.
It's like this ripple effect impacting every aspect of your life.
Precisely. And the source really emphasizes a holistic approach to rehabilitation. It's not just about getting the bones and muscles back to a functional state, but it's also addressing those psychological and social aspects of recovery as well.
Treating the whole person, not just the injury. I love that approach. So we've covered a lot of heavy stuff today. Potential complications, long-term challenges, the impact this can have on someone's life. It really makes you realize how important prevention is.
Absolutely. An ounce of prevention is worth a pound of cure, as they say. And that's where knowledge and awareness are so powerful.
Knowing the risks, taking steps to mitigate them, it seems like common sense, but it's easy to overlook those things until it's too late.
It's human nature to feel invincible until something happens, right?
Right.
But even those simple precautions can make a huge difference. Wearing proper safety gear when you're playing sports, being mindful of your surroundings to prevent falls, even just maintaining good bone health through nutrition and exercise.
Those are all such great points. But let's be realistic. Sometimes accidents happen. Life throws curveballs. So what can people do in those moments when an injury does occur to minimize the severity?
That's where having some basic first aid knowledge can really come in handy. Knowing how to apply a splint or a sling, recognizing the signs of a more serious injury that needs immediate medical attention, Those are essential life skills.
I'm realizing how much I take for granted, just assuming someone else will know what to do in those situations.
It's never a bad idea to brush up on those skills, and don't underestimate the power of being your own advocate or advocating for a loved one in a medical setting. If something doesn't feel right, if you have questions, concerns, don't be afraid to speak up.
Being an informed patient is so important. I think we sometimes forget that we have a voice in our own healthcare.
Absolutely. And on that note of empowerment, I think it's time we transition to our final thoughts for today's deep dive. We've covered an incredible amount of information about musculoskeletal trauma today, from those first critical moments after an injury to the complexities of those different fracture types, the potential for complications, and of course that long road to recovery.
It's remarkable, really. I think we tend to think of a broken bone as so straightforward, but there's a whole world behind it.
There really is, like we were saying, the impact, it goes way beyond that initial injury.
Absolutely. So, for our listeners who might be feeling like they just aced a pop quiz on musculoskeletal trauma, what are the key takeaways you really want them to walk away with today?
Ooh, key takeaways. I like that. If I had to distill it down, I'd say awareness is paramount. Just understanding that musculoskeletal trauma, it's not a one-size-fits-all situation, it's a whole spectrum.
From a sprained ankle to, like we were talking about, something as serious as a hip fracture.
Exactly. And that actually leads us to the second takeaway, which is that early recognition. We've highlighted some of those red flags, you know, severe pain, swelling, numbness, any difficulty moving a limb.
Don't hesitate to seek help.
Exactly. Trust your gut. If something feels off, it's always better to err on the side of caution.
Absolutely. And that actually brings us, I think, to our final key takeaway. And it might be the most important of all: prevention.
It really is. Like that old saying, an ounce of prevention is worth a pound of cure.
It really applies here, doesn't it?
Yeah, it does. We talked about wearing the right gear, being mindful of your surroundings to prevent falls, and taking care of your bone health with good old-fashioned nutrition and exercise. Simple steps.
But they can make such a difference.
It can.
Now, even with the best intentions, accidents happen. That's just part of life. So I'm curious, for our listeners who are now feeling super inspired, maybe want to learn more, what's something they could explore on their own? Something that we didn't quite have time to get to today?
Oh, that is such a good question. I think we've really delved into those physical aspects of these injuries, but what about that mental and emotional side of recovery?
That's so true. We often focus so much on that physical healing, but the mental and emotional recovery is just as important.
Exactly. So I would encourage everyone listening to dive into that aspect a little bit more. Look up some resources on managing pain, coping with the ups and downs of recovery, even the importance of social support during that time.
It's such a good point. That healing, it goes beyond just the bones and muscles. It really is about the whole person.
I think so.
And on that note of holistic well-being, I think we'll wrap up this deep dive. We've journeyed through the world of musculoskeletal trauma, from those first critical moments after an injury, to the importance of recognizing those signs and getting the right treatment, to that long road to recovery.
It's been such a pleasure exploring all of this with you.
Likewise. And to all of our listeners, thank you so much for joining us on this deep dive today. We hope you learned something new, that you gained a deeper appreciation for the amazing resilience of the human body, and most importantly, that you feel empowered to take charge of your own musculoskeletal health.